That the amniotic fluid is a clear yellow fluid within the amniotic sac. Now let us discuss some biochemical features of this amniotic fluid. The specific gravity of the amniotic fluid is 1.008 to 1.010. Its osmolality is 250 milliosmoles per liter, and it has got an alkaline pH between 7.2 to 7.4. And what is the clinical relevance of the statement that amniotic fluid has got alkaline pH? It is that when a female comes to you with the complaints of leaking per vaginum, how do you differentiate whether it is actual leaking of the amniotic fluid or that fluid is because of the excessive vaginal discharge? And to differentiate, we do a litmus paper test, and if the litmus paper turns blue, then you know that it is because of the alkaline pH of the amniotic fluid. Because the vaginal discharge, it has got acidic pH. Now few words about the dynamics of this amniotic fluid. This amniotic fluid is completely replaced in about 3 hours, and the rate of amniotic fluid turnover is around 500 cc per hour, because there is a continuous production of this amniotic fluid because of transudation from the maternal capillaries, from the fetal urine, from the fetal lungs, as well as the fetus keeps swallowing it, and there is intramembranous flow across the fetal vessels on the placental surface. So there is complete replacement of this amniotic fluid in 3 hours. Now, a very often asked question: when is the amniotic fluid maximum in volume? And your answer is between 32 to 34 weeks of gestation, and it is 1 liter at that time. And the most appropriate answer would be 34 weeks of gestation. And as the fetus approaches towards term, this amniotic fluid decreases gradually, and so that at term it is around 800 to 900 ml, and as the fetus becomes postdated, this keeps on decreasing more and more. Now let us learn about the origin of this amniotic fluid, that is, where does it come from? This amniotic fluid comes from both the maternal as well as the fetal sources, and the dynamics keep changing as the pregnancy advances. Now, in first trimester of pregnancy, this amniotic fluid is mainly an ultrafiltrate of the maternal plasma, and as the pregnancy progresses in the second trimester, it mainly comes from the fetal skin. The extracellular fluid diffuses through this fetal skin to form the amniotic fluid between 12 to 20 weeks of gestation. And since at 25 weeks, there is keratinization of the fetal skin, so it no more remains the main source of amniotic fluid production. So that in the third trimester, that is mainly after 20 weeks, the main contributors are fetal urine and fetal lung, and among these two, the fetal urine is the main source of amniotic fluid production towards term. So all these are important questions. In first trimester, it is from maternal plasma. In second trimester, it is from fetal skin. And after 25 weeks, since there is keratinization of the skin, so the main source becomes the fetal urine and the fetal lungs, and among them, fetal urine is the most important source. And how much urine does it produce? It produces around 1000 ml of fluid per day, whereas from the fetal lungs, we get around 350 ml of fluid per day. Now, this fetal amniotic fluid volume production is kept in balance by two processes. One is the fetal swallowing, and the fetus swallows almost 750 ml of the fluid per day. And there is also intramembranous flow across the fetal vessels on the placental surface to the amount of 400 ml per day. So all these keep the amniotic fluid in balance. Now, how does the amniotic fluid look like? In early pregnancy, the amniotic fluid is colorless, and as the pregnancy approaches towards term, it becomes pale straw in color, as you can see here. Now, this is the normal amniotic fluid, but there can be abnormal colors of the amniotic fluid, and they are depictive of certain conditions. So let's see what are those. If there is green color of the amniotic fluid, then it is because of the meconium staining, as occurs in the cases of fetal distress. When the fetus is distressed, then it releases the meconium into the amniotic fluid. In case of breech or transverse lie, again the fetus might pass the meconium in utero, leading to green color of the amniotic fluid. And the third condition is our listeria infection. In RH incompatibility, The amniotic fluid is golden yellow in color, and that is because of the bilirubin. Again one question. And in post maturity, the amniotic fluid is greenish yellow saffron in color. Now in cases of IUD, due to the presence of old hemoglobin, the amniotic fluid becomes tobacco juice or prune juice or dark brown in color. And if you have dark maroon color of amniotic fluid, that is suggestive of a concealed hemorrhage because of the old blood. Now let us see the very basic composition of this amniotic fluid, and this amniotic fluid is 98 to 99% water. Along with it, the solid substance present, they are 1 to 2%, which can be organic solids like proteins, glucose, lipid, urea, uric acid, creatinine, or hormones like prolactin, insulin and renin. They are also present in the amniotic fluid. Now the inorganic solids that are present in the amniotic fluid are sodium, potassium and chloride. Its function. Now this amniotic fluid is present in the amniotic cavity all around the fetus. So the main function of this amniotic fluid is to protect the fetus. It acts as a shock absorber and protects the fetus from any trauma. Secondly, since it is the just immediate environment of the fetus, so it helps in the maintenance of temperature around the fetus. And since this fluid distends the amniotic cavity, so it gives sufficient space for the baby to grow and prevents adhesion between the fetal parts and the amniotic sac. And in case of oligohydramnios, when this amniotic fluid is decreased, it leads to certain complications because the space becomes less. And one important thing, that this amniotic fluid does not have any role in nutrition. Amniotic fluid does not provide any nutrition to the baby as such. It has mainly protective functions. Now, how do we assess this amniotic fluid in any pregnant lady? The measurement of amniotic fluid is done by ultrasound, and the index we use is amniotic fluid index. And how do we calculate this? It is calculated by dividing the uterus into 4 quadrants and then measuring the largest vertical pocket of liquor in each of the 4 quadrants, and then we add all these 4 to get the AFI in centimeters. And the normal range of this AFI is 5 to 24 centimeter. Now if it is less than 5, then we call it as oligohydramnios, and if it is more than 25, then it is called polyhydramnios. Now, this amniotic fluid index is accurate in cases of singleton pregnancy to measure the amount of fluid, but in cases of twin pregnancy, this amniotic fluid index is slightly deceptive. So, the other parameter that we use is the single deepest pocket or SDP, and it is the depth of the single cord free pocket of the amniotic fluid. And the normal range of this SDP is 2 to 8 centimeter. So you have 2 ranges here, one of AFI, that is 5 to 24 centimeter, and SDP or single deepest pocket, it is 2 to 8 centimeter. If it is more than 8 centimeter, we call it polyhydramnios, and if it is less than 2 centimeter, then we consider it as oligohydramnios. Now if you have any confusion that how do we measure this amniotic fluid, you understand this by this diagram. Here this is our uterine cavity and this is our fetus. Now this entire amniotic cavity, we divide it into 4 quadrants by drawing these 2 lines. And in all these quadrants, we measure the single largest vertical pocket that you can see here. This is our single largest vertical pocket. And when we take this for all the 4 quadrants and we add them, then it gives us the